And now I'm going to invite up Amanda Blacklock of Blacklock Consulting. Amanda has over 30 years of experience in healthcare. She has significant sales and marketing management expertise, and in addition, has worked in marketing and sales force capability building roles across a diverse range of geographies and therapeutic areas. Amanda started her career as a medical representative in GlaxoSmithKline's pharmaceutical division, progressing through sales training, sales management, marketing research and product management before switching to GSK's consumer healthcare business, where she held a series of senior global marketing roles. In a variety of strategic and operational roles with GSK, Amanda has managed a wide range of RX launches, RX to OTC, switches and consumer brand launches. She's lived and worked in the UK, Canada and China, and now just up the road here in Kings Langley. Amanda set up her own healthcare consultancy in 2014 and works with a range of clients across the healthcare sector, helping them raise their commercial capabilities. So we're now going to hear a bit more about who is affected by adherence. Amanda.
Gosh, thank you very much for that, Paul. Okay, I'm really going to try and talk a little bit about the impact of non-adherence in terms of what it means in lives, in costs, and to different audiences. Here we go. So non-adherence costs the EU, it's estimated, 125 billion euros and nearly 200,000 lives a year. Let's put that into context. 125 billion euros is about the GDP of Hungary, and I suspect Greece is sliding down from where it was at 188 billion euros to around about that figure right now. And in terms of lives a year, we're talking about the population of Watford plus Hemel dying or being wiped out every single year. So we're not talking about a small impact. We're talking about something, I think, quite meaningful. What I've been asked to talk about is the lens of what does non-adherence, what's the impact and the implications through three different lenses, through the eyes and the lives of patients, through the NHS's vision of the world, and through the pharmaceutical industry. I have to say, with that remit, which is massive, I'm going to be very top line because, frankly, I could devote the whole presentation time I've got to each of those audiences. So it will be top line, but I hope what I give you will be of some benefit. So let's talk about patients. You've probably seen this WHO estimate before. 1 in 2 people with chronic conditions on long-term medication are non-adherent to the prescription medications and the directions that they're given by their healthcare professionals. In the UK, there's about 15 million people that have 1 or more chronic healthcare conditions in which they're given prescription medications. So let's think about that. That means there's 7.5 million people in the UK who aren't adhering to the treatment that they're being prescribed and advised to take. If you look at that statistic with your rational brain, it almost beggars belief. It feels unbelievable that many people with chronic conditions would not be doing as they're asked to do by their physician. I'm fortunate, I don't have any chronic conditions, I'm not on any long-term medications, but I do watch my parents. They're both in their 80s, and I see the struggle they have day in, day out to manage to take all of the prescription medicines that they're asked to take right now. So I have some sense that adherence, 100% adherence, is a challenge for people. But why is it important is what's its consequences, and that's what I'm going to talk about now. There's a lovely quote here from Everett Koop from the US. I'll just check my slides are working, yeah. Which is a pretty obvious thing to say. You know, drugs don't work if you don't take the medicine. And I'm just going to talk about a few specific areas just to sort of paint a picture of what that might mean. So, organ transplantation. I think everyone in this room understands that's a life-saving and really serious operation. Potential recipients can wait up to 3 years for the potential to have a kidney transplant. And the consequences, obviously, for those that aren't on the transplant list are very severe indeed. often fatal. And yet, after the operation, roughly 1 in 4 transplant patients don't adhere to the immunosuppressive therapy that they're given. And what that means is 1 in 4 people may well end up with transplant rejection. And that sets them right back to the trajectory they were on before they had the transplant in the first place, which again for me is staggering. If you think about the big toll of obesity on our population right now, type 2 diabetes is an incredibly significant and growing condition with really significant consequences if it's not managed correctly. Cardiovascular disease, neuropathy, retinopathy, kidney failure, diabetic foot ulcers, amputation, all of those things can be prevented or managed if people adhere to their treatments properly. If you look across into mental health, depression and all sorts of aspects of mental health conditions have really significant issues around adherence. I have to say for myself, I have some personal experience of somebody in my life who was bipolar, and I sat beside and watched this lovely individual struggle day to day with taking their medication. At the end of the day, I had to sit back and watch somebody pass away. I couldn't understand why we couldn't get that lovely individual to take his medication, but he didn't. So on a more lighter note, I guess I'm currently working in both MS and in asthma. Again, conditions which have really significant consequences if people don't adhere to their medicine. If you talk to an MS specialist nurse in an NHS environment and talk to them about the number of the patients that they see that don't comply with the medication that they're given, it's really quite staggering. They're on disease-modifying agents to slow the progression of that condition, and many of them cannot be convinced to take the medication. And again, any of you that have experience of working in A&E or have been in A&E will have some recognition of the number of people that come into A&E because they're not complying with their asthma medications and they get into really serious difficulty. So, those are some of the examples of what actually happens when people don't adhere to their medications. The more you think about, a simple lack of an adherence in one condition can then lead on to real complexity in terms of disease progression and comorbidities which multiply. And that really creates an ongoing need for additional support and care for that individual. That can span from regular outpatient appointments and reviews to nurse visits or to full-time carers in a home setting, all of which, from a patient's perspective, result in a lack of mobility, functionality, and really a freedom to live fully the lives they would like to live. A dependency on others, a vulnerability and fear that really impacts people's quality of life. And if you think about it, the impact of having a treatment that doesn't deliver what you hope and believe it will deliver as a patient can have really interesting consequences in terms of your relationship with the physician that's prescribed it. Many of us no longer put physicians or doctors on a pedestal, as certainly my grandparents did, and many of us maybe still do. But we still have to trust them to make the right choices and decisions about diagnosing the illnesses that we have and giving us the right treatments. And I guess if we hear stories from our friends and from colleagues and from families about products that didn't work, this ebbs away the trust and the faith that we have in doctors and indeed the NHS. So from a patient's perspective, I hope I've painted a small picture of some of the consequences of non-adherence. Now I want to talk a little bit about the NHS. I found this quote, and I thought it was really interesting. It's from 2014, so it's a relatively recent direction, if you will, from the NHS. But I'm not sure that just asking the people that work within the NHS to think about how well their patients are supported, without giving them some guidance and direction on how best to do that, will achieve the required levels of funding, resources, or the desired results. So it's a lovely ambition that the NHS has. Whether or not they can deliver with it, I'm not sure. I think we're all familiar, we have, from our own medicine cabinets, as talked about earlier, to the amount of wasted product that is purely drug cost related in the NHS. £300 million per year that could be saved in an absolutely cash-starved NHS is to me staggering. I do put my industry lens on for a minute on this as well, and thinking about the context of £300 million worth of drug cost that's wasted. Those of you that work within the pharmaceutical industry and understand the payments towards through the PPRS scheme of something approaching 600 to 800 million pounds this year might have a thought about how the disconnect sits there in terms of the wasted cost and the cost that's sort of being recycled into the NHS. The NHS is pretty much judged and measured by patient outcomes. There's a statistic here from the US, which is quite frightening, which talks about the fact that, 80% of people that have had a heart attack and then don't adhere with the treatment that they're prescribed following it are 80% more likely to have a subsequent heart attack. That's US data. I'm pretty sure it won't be that dissimilar here in the UK. And the same is true across other disease areas. I talked to you a little bit about MS patients. Half of those who are diagnosed with the early stages of relapse-remitting MS will go on to develop secondary progressive MS within about a decade of their first diagnosis if they don't take their treatment as prescribed. So again, quite significant consequences. And even within the world of diabetes, which can be managed really well with prescribed medication, someone who's non-adherent may end up with something like a diabetic foot ulcer, which then brings nursing care into their home, ongoing treatment to try and prevent what will then happen, which is either a toe or a foot amputation. All things that sort of drive the NHS to distraction almost in terms of trying to deliver the outcomes that they'd like. And the increased NHS costs and resources in managing the consequences of non-adhesion in patients when they're home-based are pretty significant, but they really pale into insignificance when they're compared with the costs and resources associated with secondary care. This US research suggests that about 20% of admissions to long-term care are driven purely by non-adherence. I couldn't find that statistic in the UK, but I'm pretty sure that's a severe underestimation of actually the true figure out there. So again, quite a shocking proportion of the costs of the NHS are driven by the care that's required once people get into secondary care. So that's a view of the impact on the NHS. Very briefly before I finish, I just want to talk about the impact of non-adherence on the pharmaceutical industry. The fact that there's so many of you in this room who either work with or are connected in your work with the pharmaceutical industry sort of give a sense of how important this aspect is. And I guess it'll be no surprise to any of you in this room to hear that the majority of pharmaceutical companies state categorically that they're trying to address this non-adherence issue in some way, and with really good reason. If you think about the real-life efficacy of products versus those that are garnered in clinical studies, there's an interesting dilemma there. In clinical studies, as we all know, you're looking at efficacy and safety in a very controlled environment, not the real world. But the way that drugs are evaluated by regulators and by prescribers is based on the outcomes of those clinical studies. And so the very efficacy data on which products are promoted and on which the expectations are set for prescribed medications are done in a setting that doesn't reflect the real behaviour of the patients that take those medications. And I mentioned this before, but there is a really there are real consequences for patients, the NHS, and indeed the industry of that progression that happens when people aren't taking the medication for the original illness and that illness progresses. In healthcare, where trust and reputation of the pharmaceutical industry is already challenged quite significantly, I think the consequences of non-adherence contribute to the erosion of trust that we see at a brand level, at an individual company level, and at the industry as a whole. If you look at the industry through the eyes of prescribers, the regulators, payers, and the media, this is an area of real challenge that, again, is crying out for the pharmaceutical industry to address and contribute value back through. In pure financial terms, it's very hard to estimate the impact on revenue of non-adherence. I've heard estimates ranging from around £30 billion to about £500 billion, depending on who you ask. In 2001, the business intelligence firm Cutting Edge Information surveyed a number of pharmaceutical companies, and they estimated about 25% of their revenue is lost through non-adherence. I think what's for sure is if the pharmaceutical industry is losing 25% or whatever the proportion is of their revenue, then so do the myriad of the suppliers that work with the pharmaceutical industry right across the supply chain. Everyone in this room basically is impacted by non-adherence. And I don't need to spell out to you what the culmination of these things mean in terms of investment in the industry and what that means to the lifeblood of the pharmaceutical industry. Let's face it, if the promise of the industry is in delivering the new innovations that improve the quality of people's health and lives, then fixing this issue is really critical. And whatever way we look at it, the impact of adherence is all about the impact on the lives of the Mrs. Joneses, the Mrs. Smiths, and the Mr. Hunters, because at the end of the day, these are the people that we all hope to make life better for. So in summary, this chart is taken from WHO data, and I think everyone in the room hopefully would acknowledge that actually the impact and the implications across healthcare systems, the population in general, are very far-reaching. Before I hand over to Paul, to hand over to Barnaby, I want to leave you with this quote from the WHO, because I think it's very meaningful. They believe categorically that increasing the effectiveness of adherence interventions may have a far greater impact on the health of the population than any improvements in specific medical treatments. And as it gets harder and harder to bring innovation into the industry and to demonstrate an additional impact above what's already out there, this area of non-adherence really could be a massive opportunity to make a difference to people's lives. That was all I was going to say.
Well, anyone who doesn't know what a big issue adherence was, you certainly do now. I mean, a couple of stats there, 125 billion euros in Europe and 200,000 lives lost. The impacts on patients, on trust, the vicious cycle with the payers, the cost to the NHS, and ultimately the pharmaceutical industry. No one gains out of non-adherence. So that was a fantastic introduction. You set the scene very well there, Amanda. Thank you very much indeed.